today we're looking at high intensity gait training and how that impacts stroke recovery as people are on their journey to achieving their goals in mobility and getting home. And what we really are emphasizing is tracking their heart rate, objectively looking at how fast their heart is beating, because we're aiming for certain zones of their heart rate max. The goal is to push the patient. Unfortunately, at times we avoid doing, especially with neurologically impaired patients, because it might feel like it's too much. And what this treatment approach shows us is that the more the better. A lot of the research that currently is available shows this really incredible connection between the heart and the brain. And when that threshold is crossed, the heart actually starts to release a lot of growth-related neurotransmitters into the bloodstream. And those growth factors are designed to help an injured brain heal. And so that is really the treatment approach. That is the goal of trying to get their heart rates to that level so that the brain and the heart can start to help each other in the healing process. That might look like 15 to 20 minutes on the treadmill, 15 to 20 minutes over ground, and then 15 to 20 minutes doing something more variable like stair training, negotiating obstacles, stepping over objects, walking on uneven surfaces. We're tackling kind of all the different pillars of the high intensity treatment approach. When we are doing these sessions with these folks and they're motivated, they're medically stable, they're engaged in the activity, we're seeing a visible, objective improvement. These small things like one day before, they walked 100 feet and it was really, really hard. And it took two of us to where 2 days later, we're walking 500 feet and now it's just me helping them. Those small victories where we can look back on it and say, okay, we keep doing that. And over the next 7-10 days, now you are starting to see those no doubt changes in mobility. We are seeing that progress on the day-to-day. Sometimes it's small, sometimes it's baby steps, other times it is more leaps and bounds.